You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these half-hour segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. And before we dive into my special guest today, I want to take a moment to let everyone know that we'll be broadcasting the This Just In radio show again live from the HIMSS annual conference next March in Las Vegas. Many more details to come, but I hope everyone is planning on attending. It's always a great time with your 42,000 closest friends, but we'll certainly have another great slate of CEO, CIO, leading care providers, industry thought leaders, and certainly policymakers joining the show. For this episode, though, my 108th episode, we're speaking with some special friends, and we're going to have a show dedicated to the upcoming Health IT Leadership Summit here in Atlanta, Georgia. The summit will take place on November 7th from 7:30 a.m. to roughly 7:30 p.m. In an exciting action-packed agenda. So with that, let's welcome to the show Jodie Braner, a health and benefits consultant for Willis Towers Watson and acting summit chairperson for the second year. Congrats, Jodie, on that. And Lynn Hood.
Thank you.
Yeah, top colonel from Crackerjack Marketing and chairperson of the summit each year. You both were on my 80th episode as well, talking about the summit last year. So I'm so happy to have you both back on for the 108th episode this year. So welcome to the show, guys.
Thanks, Justin. And I am the chairperson for marketing. I would not have Jodie's job. She is a saint for doing it. It's a lot of heavy lifting.
Oh yeah, no, this is your second year, Jodie. Yeah, this is your second year.
Yes,
Jodie?
it is.
Yeah. Like,
yes, it is.
Excellent. So let's start off. I mean, obviously, we've all worked together a long time with the summit, but also just in the industry in general. And we all get excited. This summit we all look forward to every single year. But I don't want to steal any of your thunder because you both have a lot to contribute here. So first of all, let's just start off. Tell my audience about the summit, Jodie. Where is it being held, and just some of the logistics and what can we expect for attendees and the history, all that good stuff.
Sure. Thank you, Justin. So the event this year will be held in the Dunwoody area. So for convenience, there's lots of ways to get to the Crown Plaza, Dunwoody. That will be held on November the 7th. It is a sharp early registration, 7:30, 8 o'clock is the kickoff. We are excited about the new location and the numerous speakers and panels that we'll be offering. In the past, we've had folks attend from all over, not just in the Georgia marketplace, but also from out the Southeast nation, and we're expecting some nice guests from the West Coast again this year as well. We think that it's an excellent opportunity for folks to hear and learn from the inside of leadership on all levels. So that means from the provider perspective, the employer perspective, vendors, related health informatics specialists, educational institutions, and even students, traditional and non-traditional. We really feel that is a great opportunity for all to come together and collaborate.
No, that's terrific. And, to your point, what do we expect? Around 1,200 or so? I forget where we were at, but I think we're around 1,200 or so attendees each year. Does that sound right?
Well, that's an exciting number. We haven't quite hit it yet, but that is a nice goal.
Yep.
We're ranging right around the 900 mark.
Yep.
But who knows? Maybe this will be our year.
Yeah, no, we always get a lot of late attendees and participants as well. But I think my thought there and what I've always seen is we are the second largest health IT conference in the country. The very first one is the HIMSS annual conference. It started off at, started off with probably 5,000, and, we went to 10, 15, 20, 25, and now we're at 40, plus thousand. So it's just, we continue to grow, but it's kind of exciting to see this Health IT Leadership Summit and the growth that it's had and the amount of people from all over the country. It's certainly not just a Georgia thing. That's why we don't call it the Georgia Summit. We call it the Health IT Leadership Summit, because we do attract from all over the country. So, congratulations on that. Very cool.
Justin, it's been exciting times watching this grow over the last 8 years and to see the development. If you recall, 8 years ago, our primary focus was jobs, 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 because we were coming out of a recession, and that was what people in Georgia needed. And so we started looking at the number of jobs in health IT. We looked at the growth. We looked at the companies we had here. And that's when we branded Atlanta as the health IT capital of the nation. Now, other people may have higher revenues and may have some more jobs, but this really is one of the true centers of health IT. In fact, HIMSS began here, 50, 70 years ago. And so it's an area that's very, very important to the state and to the people of Georgia.
No, very, very true. And I don't know where the numbers lie today, but I know roughly we always have around 250 health IT companies. I've personally started 3 of them at this juncture, and I'm working on my next one. So it's very exciting. It's a very exciting community, and this summit always pulls all of us together. It's a great reunion, but also it's a great opportunity to meet a lot of new people and just to collaborate, not only with health systems, but other innovators, other thought leaders, like you mentioned, students. So so many different people come together. So talking about that and kind of jumping off there, Jodie, tell us about the theme for the summit this year and the initiatives surrounding it.
Well, we're very excited. The theme this year is what's next in healthcare, initiating collaboration and innovation within our communities. So really, where are we today with our healthcare delivery, and what are the key components that we see as professionals in all of those segments, if you will, for the future? So it's that collaboration and innovation component is tied throughout the entire day, where we kick off the morning with some introductions from our keynotes. And our first keynote is Shahid Shah. He is the chair and co-founder of Cytus Health, but also an award-winning health IT, bio IT, digital medical device inventor who has over 27 years experience. He's got a very avid blog writing, dialogue, as well as he's an avid speaker in other arenas. So we're excited to have him kick off the event kind of with that futuristic discussion where he's going to talk a little bit more about how leaders can adapt to the rise of artificial intelligence and machine learning. I think that will be a really great way to start the morning, and then roll into some of the modules, if you will, and panels. So we've got a couple general sessions and then a couple breakout sessions. And we're going to talk about everything from workforce and what's going on from the industry and academia, if you will, to talent opportunities, where internships and actual opportunities are open. And then kind of into some specifics where we're talking about some things that it had recently rolled out, as you know, with macro and so forth. Yeah. So a discussion regarding fee for service to value based. Is it working? How is it impacting the public? And what about the private marketplace down the road? Commercial, that is, the commercial business. Sure. So that should be a very dynamic discussion. And then, of course, we can't have a day without talking about the consumer. And there'll be a nice panel put together about consumer digital health and today's patient-driven technology. So that discussion, we'll talk about all of the challenges we see and any barriers in regards to social norms, whether it's regulation or politeness, what have you. Providers and IT companies coming together to solve those challenges is what's going to make this day exciting.
Oh, that's awesome. That's exciting. So I couldn't agree more. I try to bounce between as many sessions as possible, but it brings up a point. Who usually attends? We covered some of the ground early on in the conversation, but specifically, who usually attends? And then, what do they get out of attending, in your opinion?
We have a very diverse group, and we welcome that because this is an educational event. As you know, it's a nonprofit educational event that's put on intentionally to bring folks together, as you mentioned earlier, to have an opportunity to network, see what's new and innovative, and hear kind of, where are we? Are we at the tipping point of healthcare delivery? I don't know. Let's find out. I think that's really what draws. So you get a little of everybody in the audience. From you'll have vendors, of course, that are related to all of the different components of health informatics. You'll have some educational folks there from the institutions that are in place here in Georgia and throughout the state. You'll have providers, whether it's a hospital or a large provider group. You'll have employers from many perspectives, those that are within the healthcare industry, if you will, and also those that use the healthcare delivery system. So it's not one specific set of people. You're going to have a very diverse crowd, and you're also going to see folks out there within that networking component, perhaps a traditional student just entering the workforce, or maybe you've got a non-traditional student out there in attendance learning about, well, where's the future going? What additional skill sets do I need to be a part of that future?
That's a very key point, because I think we've been talking about this and actually created a lot of programs for the local colleges, and actually colleges all across the country, certainly in our community colleges, but a lot of four-year institutions as well, helping them create health IT certificate programs and just health IT training in general, because of healthcare and health IT is growing dramatically. And so, many that listen to my show are deep entrenched in healthcare and health IT, but certainly we need help. We need all the resources that we can garner. It's continuing to grow. It's an exciting sector, a lot of innovation, and just tons of opportunities. So that's another reason why I go every year to the summit, is I like to just make sure that I'm on top of everything, make sure that I'm engaged, see a lot of my friends and peers, but then just make sure that, I'm looking for the very next opportunity in healthcare, because it'll certainly be there.
Justin, one of the things I find so exciting about the summit every year is not just the opportunity to meet new people and basically do business development for my business, but I like being able to connect people. And so you may have someone that that's over in academia that's working at Georgia Tech, and they just have a new analytics platform, which they do, by the way. They have a new analytics platform that you can then put them together with someone in state government that's looking for that sort of information, or a vendor that's trying to add a population health component to their EHR system. So there's a lot of opportunities to bring people together and to build an even stronger community and stronger products and opportunities for everybody.
Oh, that's
absolutely, Lynn. And I would be remiss if I didn't finish in sharing how excited we are to have a second keynote to close the day from the CDC. We have Dr. Chesley Richards, who's the Deputy Director for Public Health Scientific Services at the CDC, speaking. And that is exactly one of the things that he is going to address in tying up the conversations of the day, talking about public health issues and in terms of HIT regulatory environment and so forth, but also beyond that, in how do we change behaviors from the consumer-driven component to help people become more healthy? How do we drive people to healthy behaviors, and where is that overlap? And then what are the skill sets needed to truly improve our relationships and the informatic highway, if you will, from data analysts to scientists to big data? So how can we connect all those social buttons and improve our ecosystem. So we're really super excited to have our end close note on that level, especially since they're right here in our city.
Yeah.
Be able to hear more about how the big picture is being looked at and offering all those opportunities.
No, it's excellent, and I couldn't agree more. Certainly, there's a lot of aspects of precision medicine and public health that are going to grow in importance with our healthcare system. So very exciting for sure to have someone from the CDC. And for everyone that may have joined us a little late, my guests today are Jodie Braner and Lynn Hood, representing the Health IT Leadership Summit that's going to happen on November 7th here in Atlanta, actually up in Dunwoody at the Ravinia. So I guess, Lynn, taking a little bit of a deeper dive into our event, we've always spotlighted innovation and leadership in the community. So tell us about the awards this year and what can we expect?
Well, Justin, the awards are one of my favorite parts of what we do, and getting to recognize and getting to see what's going on. It's a fun part of having been involved with the Innovation Award since it started, the first year of the summit. So we still have, it says, I've changed it tomorrow on the website, I promise. We're still accepting entries into the Innovation Award. And what we do is we usually get, 2-3 dozen really interesting submissions, and they range from everybody from Greenway Health, which was a winner one year, all the way down to some startups that are very early stage. And we've had just some terrific winners for this, and we will narrow this field down. We've tried to simplify the submission process and make it fairly simple for people to get on. You can do it. There's if you go to the website, www.healthitleadershipsummit.com. I know it's long, but it's easy to spell.
It is.
And go to the awards and take a look. You can go right and do an online form and fill it out, or download a Word form and fill that out and send it in. So we're going to keep those open to the 10th. Of October, and then we'll go through, we'll pick 4 finalists, and the 4 finalists will be invited to the VIP party the night before the summit, and we'll announce the winner there. And the winning company gets a gorgeous piece that they can put into their corporate waiting room or their garage, depending on their level of how advanced they are. There's some HP started in a garage, right?
Oh, yeah.
And so that's the Health IT, that's the Innovation Award. And then we also have awards that are presented by the Metro Atlanta Chamber called the Phoenix Awards, which represent the rising from the ashes. And these awards recognize 3 or 4 of the top people in our community that are really making a difference. And so this goes to, I believe, we often have a hospital of the year, community leader, business leader, and then a startup. And it recognizes the organizations and the people that are truly making a difference in our health IT community.
Yeah. No, I'm actually staring at my Phoenix Award from, I think it was 2011, maybe. I'm actually staring at it right now. So.
I remember when you got that one.
Yeah, very, very cool.
Quite an honor.
Yeah.
Quite an honor.
Yes. So I appreciate the detail there on the Innovation Awards. It was something I remember Greenway did win it as well. I think in 2013 or something, and for one of our innovations, specifically our Prime Mobile product. So I do recommend.
I was going to say it was an open source mobile application that you made available. Yeah. That was something that was really, we had Dr. Bronstein from Georgia Tech was quite impressed. Everybody looked at it and went, this is really innovative, and we wouldn't necessarily expect that from a big organization.
Yep. No, and that's why I recommend people do look at the Innovation Awards, but then also, make sure that you come on November 7th, because that's when you get to see and hear from a lot of these really cool innovations. I've been on that committee too before, where we just have, I think you mentioned, up to 36 or so applications. There's a lot to pour through in these companies, and we'd rate them, but but the innovations that are occurring all over the country, not just all here in the Atlanta community, many are here in Atlanta, but they're from all over the industry and the geography, and it's really cool to see. It's inspiring, and so you're going to be able to see that on November 7th as well.
It's not too late, please. If you, anyone who's listening, or you've got a business of your own, or you know of someone, please let us know. We want to hear from you.
And if you've applied previously, you are welcome to apply again, including people that were the finalists and then didn't make it to the top. There were some companies that I know we've looked at, and Justin, you recall this. Jodie, you've been there. You look at me and go, gosh, this looks really great, but they're a little early stage. It's not quite fully baked yet. And so, I urge these companies, and it's not just for the South or the Southeast or Georgia. This is really open to anyone across the nation that's interested in receiving some nice promotion and maybe getting a little bit of attention from investors along the way. It's a good way to validate what you're doing.
Very, very true. Great point. So just in our closing moments, I would like to dive in a little bit of the afternoon workforce module. Tell us about that, because it's very unique. I've never seen that in a summit or a conference before. So, Jodie, tell us about that.
Well, I'm glad you asked, because we did some serious research, if you will, over the last 7 years of this event, and felt like it was important to kind of divide up the day and dedicate a whole module for talent. And that is allowing talent at any level to hear about what opportunities are out there and not only learn, but actually have an opportunity to interview. So from 2 to 4:30 in the afternoon, it'll be a separate, standalone module, if you will. The core main sessions will have adjourned by then, meaning our keynote finishes at 2 o'clock. And so that all attendees have the opportunity then to move into this second module to hear a panel of diverse employers and educational institutions, et cetera, speaking about areas that students, regardless of their stature, traditional, non-traditional, and where the pipeline for recruitment is taking place, so that they can learn about new jobs as health informatics continues to evolve. There are new roles being designed and developed that have never been taught in a classroom setting before. And that's really the intent, is to expose that, allow folks to see where the future is going, and then to help teach other institutions to develop additional educational internships and such to allow us to build a nice skill set workforce in Georgia for all of these up-and-coming, blooming inventors and existing companies, so that we can continue to grow and being a leader in health IT today.
That's fantastic. Yeah, I've never seen that before, and obviously very thoughtfully done. So that's terrific. Obviously, there's a lot here for a company to engage, not only with our employees, but also, can we still sponsor? Can companies still sponsor? So, Lynn, are we still open? Is the summit still open to engage this after learning so much more about it?
We are still accepting sponsors. There's a couple of really nice prime spots available as far as sponsoring some specific educational modules. Okay. And if someone has a specific need, then I know that the sponsorship committee would be very happy to work with them to find something that makes sense from that supports the business and is an area they're specifically interested in. Yes, we are still accepting sponsorships. It's a great time to get in front of people.
Thank you, Lynn. Yes, and thank you. We definitely have some spots open, and we also have decided to be a little creative for maybe those up-and-comers. There's a new inventor in town, if you will, and maybe not in a position for a full-blown traditional sponsorship, but would like to be a friend of the summit. And to be a friend of the summit, we'll take any value of donation that you want to make, from $25 all the way to $1,000. You can become a friend of the summit. So nothing too small this year. Our goal is just to help recognize and support our community so that we can continue in this manner and highlight the innovation we've got right here in Atlanta.
That's fantastic. Well, guys.
And Justin, and one more thing, let me throw one more thing in. It's worth mentioning that this is one of the first times in the state where we had 3 organizations come together to found this. And we would be, again, remiss without mentioning the Metro Atlanta Chamber, the Technology Association of Georgia, and the state of Georgia have all combined to organize, sponsor, and support this event since its formation.
No, very, very good point. And they're all fantastic collaborators and extremely supportive of the health IT industry. So, no, thank you for that, Lynn. So, guys, it was great to have you on the show again. I certainly look forward to seeing you guys on November 7th. And again, truly appreciate you guys taking the time out of your busy schedules to join us on the show. And thank you to everyone for listening. Please check out Health IT Leadership Summit at healthitleadershipsummit.com. And plan to join all of us and 1,000 of our closest friends November 7th here in Atlanta. And certainly thank you for joining us today. And please tune in weekdays, 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustIn so we can respond to your comments from the show. In addition, all my content's always available at justinbarnes.com. Thanks, everyone. Have a terrific week.